Do you have some hip or groin pain? Get your Theracane, get a plunger stick, get a Broomstick, because we've got Tim Sawyer, physical therapist here, who I highly respect, and he's going to take us through some trigger points for your hip and groin pain. Go ahead, let's start on your back.
Let's start with the obliques, Adam. The obliques, they live in this lower corner of the abdomen. And let's start with your right side. We're going to do one side, and so you could always do the next, you could do the video again to do the other side.
So we have this bony protuberance here called the ASIS, and where are we going in relationship to that?
If we find the ASIS and we find the belly button, and we want to go about halfway between the two, right about there. And if you're too far in the middle, you'll be on the rectus abdominis. And these muscles can refer right into the groin and right into the genitals. We're concerned about really releasing this tension down through the groin and sometimes out through the hip.
You also have the ileocecal valve there too, so if you release your inner child tomorrow morning, you'll know why.
That's right. This can release a lot of tension for folks that have some GI upset.
Now with trigger points, you really want to breathe. You want to just let your body go into that rest and digest. You're using your arms to push a little bit, but your face has to be completely relaxed.
And after you do this oblique, you could just lift up gently and back up about 2 inches right there, and there's another part of the oblique.
And that's just straight down?
Straight down, straight into some tender muscles.
I'm actually feeling that in my groin.
Yeah, it'll refer right down.
Amazing. There's some fact to this.
The external obliques are like putting your hands in your pocket, and the internal obliques are going the opposite way, but they're right on top of each other, so it's really important to release these muscles. These muscles can also mimic the tension of a hernia.
So we're doing just one side for you. If you need to do both sides, just do the video again. Most people just have one-sided hip pain.
Right, and the only precaution doing it on the opposite side is that there's a big blood vessel that runs down here called the aorta. And so you want to make sure if you push down on this other side, if you feel a big heartbeat, you want to back off. It's pretty self-explanatory once you try this, but let's just concentrate on this right side. Let's now move to the psoas. And we're going to go now find the belly button and go out about 5 to 6 inches, so about a hand's width. It's kind of in a similar location as the oblique, but you're going down 20 seconds deep. And once you get down 20 seconds deep, you want to tilt your Theracane up about 30 degrees.
I haven't gone 20 seconds yet.
Okay. You got to make sure. He always checks me to make sure I'm doing the right thing here. After 20 seconds down, then you want to tilt the Theracane up about 30 degrees, and you want to pull towards the midline.
Oh.
You feel that psoas there?
You're right on it, Tim.
Beautiful.
Loving it.
As we had mentioned in our other videos, that the psoas is responsible for low back pain, but it's a big responsibility for groin and hip pain as well. So really important.
Do you get sore glutes sometimes with the psoas tightness?
You can. If the psoas is really tight, it can facilitate some weakness in the glutes.
Mm-hmm.
And people will strengthen the heck out of the glutes, but they don't seem to get strong enough because the psoas hasn't been released. So it's important to release the psoas if you're doing a glute strengthening program. And then if you release this and go about 2 inches further up, you'll still get a little bit, as long as you're at the belly button level, you'll still get some of the belly of that
Still
psoas.
go down for 20?
Down for 20.
And then if those glutes aren't deactivated, then the hamstrings get too tight.
Right, it's this whole combination of things. And for those of you that are really tight, when you're doing this, just bring this knee up on the side you're working on and just right there, hang out there for 30 seconds. And you'll eventually be able to tolerate this with the leg flat. You're doing great.
And now I'm going to tilt it.
Tilt it, pull it in. Right there, you feel it, I can see it.
Oh, come on.
As you release this, then you could slowly release the leg all the way down. Slowly all the way down, and just feel that length of the psoas. Just awesome.
Almost like an active release.
Beautiful. Exactly.
Mm-hmm.
And then the next one will be our iliacus. And as you release the trigger point slowly, to find the iliacus, you find that bony protuberance called the as is. And
I'm going to do it for our people that are using a broomstick. I'm going to do it like this.
absolutely.
So we go to the bony protuberance and we go just inside of it.
Yep. Push down. And you now want to tilt this and push away. There we go, just like that. So the psoas is down and in. The iliacus is down and away. Beautiful. If you don't have a Theracane, you could use the end of a broomstick or even the end of a wooden plunger. Beautiful.
So it's just angled right to the side of my body.
Right.
Right in there.
Looking good.
Feeling good.
Feel that hemp tension just slowly release. And these muscles, the psoas, iliacus, and oblique, is really for the front of the hip tension. And now we'll work on the side muscles that are more for the side of the hip. And when you're ready, slowly you could release. And for this one, you want to bend your knees. And the first one you want to find is really the glute minimus. And it's right on the side.
Right directly on the side of the hip.
And then you can slowly roll your hips over onto it.
So pull it this way.
Pull it to your left.
And then roll onto that.
And that's just an intense feeling.
We call this Gluteus Minimus. Oh, yes. But it gives gifts when you release it.
That's right. And the gluteus minimus is really the side of the hip. And the next one that we get after he releases this one, after 60 seconds, then you'll do the TFL. And the TFL is slightly in front of this one, so it's forward. And it's another one that just feels so intense, but it can really give you a lot of relief of your hip pain.
People are so focused on the medius, but the minimus just doesn't get the attention.
Right, and the medius it's a glute pain, it's a low back pain. The minimus, though, really goes into the hip, along with the piriformis, TFL, and the Obturator, Internis. And it's just a great muscle to release. You'll feel so much relief in that hip as you release this muscle. And as you release, roll back over off of it. And the TFL is really same location as minimus, but it's quite a bit forward. So it's really kind of on the top here.
Just inferior to the ASIS.
Yes. And it's a muscle that you could either use with this pulling down, but why don't you do the same kind of thing with your broomstick handle? And just so people can get an idea that you could do both.
Do you like the legs bent on this one?
You can start with the legs bent and then slowly let them down. And it's a tough muscle to get.
It is a little tough, isn't it?
It's probably one of the most challenging muscles because it's really tight.
Balancing on a tightrope there.
Yes.
I think I'm going to try this way also. There we go.
That's a better angle.
Better for me.
Yep.
Yeah. This is a nice one to hit with a lacrosse ball also. Foam roller.
Right.
Just all your body weight on it, just letting it go. Here's the love right here.
That is awesome. Nice deep breaths into this stretch. So people ask what trigger point release is, and it's essentially a very specific stretch on a very specific tender area. And that's why it's good to search for those painful spots. Once you find the painful spots, just apply pressure, and you're just doing a very specific stretch.
Sometimes you think you're not on it, and then you just wait. You wait a good 20 or 30 seconds, and oh, there it is. It's revealing itself. You had to get through a few layers before you really felt that pain, that good pain, that is.
Right, and trigger points kind of hang out. They're like layers of an onion. You could be pushing down into the top layer, and that releases. Then you push the next layer down, a little more pressure, and the next layer down. Once you get all the layers of the onion, that's when you start feeling a lot of relief. The next one after the TFL is going to be the Piriformis. And you could bend your knees up for this, or just the knee you're working on, bend the knee up. And you want to put this Theracane right in the middle of the butt. And if you want to shorten it, you let the leg hang out that way, but you could just shorten it. You'll feel it right in there.
Oh, yeah.
Yeah. And it goes deep. Again, this is a muscle that you need to just be cautious of the sciatic nerve, because if you push too deep, you could push into the sciatic nerve. So you got to be just very gentle and cautious to make sure you're feeling the pain, not any nerve tingling down the leg. Really important.
Piriformis means pear shape, and oftentimes it's a pear shape, but the sciatic nerve can go right through the piriformis. So people can get what's called piriformis syndrome, that is a sciatica from a tight piriformis, right?
Right, and or the muscle could be so tight that it actually compresses the sciatic nerve in that sciatic notch.
Feel a little of that in and around here even.
You could get some referral down the leg for sure. And as you release this one, then we want to find the tendon of the Obturator Internis. And this is a little tricky, but you want to find that bony prominence right on the edge. And that is called the greater trochanter. So you put this on the greater trochanter, just like you did here for Iliacus. And then you go just slightly behind it. And then you roll, and you can bend both knees. And you want to roll right over
So
on
slightly in front of it.
in back of it.
Oh, in back of it. Okay,
But
got it.
Slightly in back of it.
So you're just rolling off that bone.
Rolling off the bone, and then you want to lean gently on it. This is a really hot spot. And to find it, you could just wiggle that back and forth, and you'll feel that tendon underneath there.
We got it.
Yeah.
Oh, a little burn actually.
That's a big one.
The
It's a big hip pain guy, and the stretch for TFL and Obturator, you'll find out when we do the stretches, it's very similar. So it's important to do the trigger point work and then go to the stretch video. Really important to follow up with the stretches after you're doing these trigger points. But you can see how these relate to hip pain, huh, Adam?
Oh yeah.
Yeah.
Do you think that these will even bring the femur more into the socket if they're too tight?
Oh, people that we see that have diagnosis of labrum tears or tight hip sockets, a lot of times this muscle will just be so tight, it's just not allowing any motion whatsoever. And once it's released, people's hip pain starts to really improve.
For those internal derangements and those capsules that have adhesions, I like to use extracorporeal shockwave therapy and send it all the way into that joint capsule and really break up the scar tissue adhesions. Then you get new blood vessels and you actually get new collagen formation.
Beautiful. Now let's sit up and face that way. You just cross your legs there. We want to find these important muscles now that really can cause groin pain. And one is called the Adductor Magnus, and it's a big muscle that's right here on the sides. So if we take the Theracane and kind of come into this direction, and you push down from the top, yeah, you can get right in there.
How do I know I'm on the Magnus?
The Magnus is, it's like a tenderloin. It's the thickest muscle inside the middle of the leg. And you'll feel a tension that's not just referring down, but it can refer right up into that groin. And it's such a thick, hard muscle.
Ooh, that's good.
Can you
right
feel
there.
it there? Yeah, so search around for a little bit. It is deep, and it's just such a big, gigantic muscle. So
Do you want to go towards the insertion?
you want to work where you are,
Mhm.
and then you want to slowly go towards the insertion. Right there, exactly. There's 2 ways to get this too. After you get it this way, you could also go with the hook around and come from the underneath side. Because it's such a thick muscle, you want to get the top of it and you want to get the bottom of it. So once you do this one, I'll show you. You'll flip it around.
Beautiful.
And it'll be kind of...
Let's do one more.
Yeah, that's great.
Oh, it's balancing on a tightrope there.
I think you could see if the adductor magnus is tight and the oblique is tight on the opposite side, those are playing tug of war, and your poor groin in the middle is the brunt of all that activity. So if you release, for instance, the obliques on one side and the adductors on the other side, everything just releases, just like this side. Now we're releasing one side, so I would recommend that you redo the video after this and then do it on the other side as well, even if you have one-sided pain. And then this one, flip around this way and come underneath. And then you could pull it upwards and get the bottom of that adductor magnus.
Oh, yeah.
Yeah, so and if you're too far towards the middle, you'll be on the medial hamstring. But you really want to be towards that. Yeah, exactly.
Oh, there it is.
Yep.
Once you hook it, you're going to hook it, and boom, you're on it.
So the hamstrings and the adductors are certainly similar, but we're really looking at muscles that cause the groin and hip pain. Beautiful. Once you release this, there's one more important one. It's called the Pectineus. And again, this is one that's just right up high, kind of it's actually in the groin. And so if you turn the knob around and use that one would be great. The real critical precaution here is that you want to avoid what's called the femoral triangle. And that triangle houses the arteries and nerves. And so if you're too far towards the middle, you'll feel a real tingly kind of apprehension. So just move a little bit laterally this way, and right there's the Pectineus. You feel it, yeah. So you're just you want to get on the outside. If you're too close to the middle, you'll feel a heartbeat under that blood vessel, and sometimes you'll get a little nerve twinge. You want to make sure you're not on those areas. You want to get
and just come out a bit.
You want to come out to the side, and boom, there's that Pectineus. Beautiful muscle. Yeah, working through all these muscles, you'll really help to release from groin and hip pain.
Right, you can do the hip stretches video. We have a massage gun for hips video, and your hips are going to be happy. Thank you so much for being with us and taking care of yourself. You're wonderful.